Welcome to Freeform's Personal Trainers Who Care podcast. We're so excited. We have Christine here with us today. She is the owner and founder of Focus Forward Health Therapy.
That's Focus Forward Health. Yeah, we
okay.
rebranded. So that's a mixture of the two. Totally, we would know and it'd be like, yes, that's us.
Yes, perfect. So Christine, tell us a little bit about your business and what you do. Obviously, we're talking to a bunch of Freeform clients who are the most amazing. But the biggest thing that I wanted to do, I'm always looking for experts out there that specialize in what they do and try to kind of fill the gaps for our clients so that they have resources. So tell us a little bit about what you do.
Sure, happy to. So I'm Christine Harrison. I'm a registered psychotherapist. I'm a registered clinical therapist. So I founded Focus Forward Therapy Group, the original name, back in 2015, psychotherapy practice, myself, working on the side. I worked a regular day job in nonprofit and mental health. And then we grew and we brought in some other clinicians I incorporated. And then I started to grow even bigger and I decided to open a storefront location and we decided to make it multidisciplinary.
I love that.
I'll say we a lot, mostly because it makes me sound less narcissistic, but for the most part, because I do think of all the different parts of my brain that kind of form like a team. So we decided to become an interdisciplinary clinic, and then we rebranded to Focus Forward Health because we are more than therapy.
Yeah.
But therapy is the auspice of everything that we do, right? So the idea that unless your mental health is being addressed, all the physiological components that go with it will never be fully successful. One of the models that we really believe in is personal training. We always say, like, if I write you this prescription for working out, you probably won't come back here. But what we've learned is that that alone is not enough, and that the combination of the supportive therapy along with personal training, dietitian, all of the other services that we offer tend to work best for success.
Yeah, I agree.
We have 3 brick and mortar locations and then virtual across Canada. Our women's health clinic is launching in Newfoundland and British Columbia in May.
That's so exciting and perfect for Women's Health Month, which is why we wanted to also have you on here today because we really want to focus on women's health. And I know you are an expert. I'm like excited to talk and pick at your brain a bit today. So your brick and mortar locations, where are they? Sorry, again?
So we have Hazeldean,
Yep.
we have Stittsville, Maine,
Yep.
and then we have 680 Pembroke Street East in Pembroke.
Yay,
We're very excited.
new location.
It's a really underserved population, and we're talking about women's health. Where are folks going?
Yeah.
Where? To the Pembroke Hospital? To the family health team that's fully booked. So it's just another option for folks who have capacity, who have benefits, who want a little bit more of that boutique or concierge health service.
I love that. And that's why I think we connected so well too, because we're both trying to do, God's work right now. Like truthfully, like we're trying
Humbly.
I know that sounds really, but like truthfully, we're trying to, make changes because we're seeing the impacts of, our medical system, how, they're overworked, and we're trying to fill the gaps in what we're trying to do. And you do, like we talked about all the time, we focus on the physical health, but there's also the mental health side of it and the deep dives of that. So I'm excited to talk to you today.
I'm excited to be
here. What led you to specialize in women's mental health?
I would say I'm a late rise feminist. And, I only really found my feminist roots when I had children. And it came through identifying my parenting style. I didn't even know that attachment parenting was a thing. And then I fell into it. And then I started to see the disparity between women and men's healthcare. And I started to realize that we were being pushed aside. It's funny how if you don't know what you don't know until you know. And once your eyes are open, you can't look past it. Then I had my own girls, and I was like, well, hells no, this can't be happening. Our healthcare system and our mental health system is, in fact, designed by men, right? For men. And we've always been on the wayside until recently. Women's healthcare has not been given a second thought. Right now, we're in the mega business of, midlife women, because there's quite a few of us now. We kind of went through that boomer stage, and now we're at this new stage of these Gen? Oh my gosh. X's. I'm Gen X.
Okay.
Okay, so I'm 79, full disclosure on my birth year. And we're all hitting menopause. We're all menopausal. And my own journey helped inspire, but of course my roots have always been in healthcare. My business was founded by women, completely run by women. Everything from construction to website to logo was done by women. And I always felt invest back in women. And so why not invest back in women with specifics in our healthcare clinic? Turns out really needed.
Yeah. You're making like huge changes, and you're changing the game.
It's so exciting to see. And, whether we're friends, whether you've just met me, you can still reach out to me. I will still hook you up at the clinic.
I know. You're so kind like that. Even just like our conversations, I was like, wow, you're brilliant. Like you are truly brilliant at what you do. I have to say that.
I'm going to come here every day, actually.
Why do so many women feel like they have to do everything perfectly? I'm guilty as well.
Yeah, I feel you. I feel like I was a martyr when I first had my kids. Like, I'll do it all.
Yeah.
Now I'm like, oh no, you want to host? Okay.
Yeah.
I'll come over.
Delegate now. I'm like, oh my gosh.
There's a lot of pressure. There's a lot of society and self-imposed pressure. So we carry this invisible load with us, the invisible load of not only the everyday, and I use these terms and they're not meant to be indignant, but like the burden of childcare, right? Or the burden of the home. And we carry it. Nobody sees it, but it's there. What's for dinner? You've probably heard me talk about this, like the 3 o'clock doom. I remember it, working in the hospital and thinking, oh my God, okay, like I got to get the potatoes. I'll have to peel them. As I'm seeing patients, I have this running dialogue of peeling potatoes. It's crazy, but we carry this with us all day long. So of course, there's going to be this self-imposed version in your head that goes, yeah, you better get it all straight. Well, that, of course, sounds like you have to be perfect. If you have all this work that nobody knows about, but you feel like a failure if you don't do it, cue the perfectionist traits come in, right? The people-pleasing. Women are typically people-pleasers. We're all born defiant. If you think about your children when they were toddlers, everything was like, no.
Yes.
Me, mommy, I'll do it.
Oh my gosh. I'm like, yes, I remember.
And that's great. And that's the autonomy that we develop. But then somewhere along the way, we get the message that we have to please people, right? And women were fed a lot of that. Look pretty, be quiet,
Yes.
right? And I think we've done such a better job, like raising our own children and knowing that that's not the type of messaging that you send. But, our generation and forward didn't get that. So cue all this perfectionist traits that are just floating around in Ottawa. And we have so many high-performing women in Ottawa, so many successful women.
And we have to talk about this because when I met with you, obviously, like we surround ourselves with very, great, like-minded people, great business owners and leaders. And the biggest thing is the leadership part.
Yeah.
And you had shared, I see a lot of type A people in that. And what happens is like this burnout, So can we talk a little bit more about that and how you identify, burnout and how you treat it?
And the type A is really coming from a generation of boomers who had children who are now in these C-suite positions, these entrepreneurs. We have so many entrepreneurs in Ottawa, and most of them are women, to the percentage of over 75% are women-owned businesses. That's significant.
In Ottawa?
Yeah.
Over 7?
Over
Are you?
75.
That's impressive.
Yeah, I'll send you the APA documentation later. But
Go
yeah.
girls. Jeez.
We're killing it, right?
I love that.
So we have all this caring for the home, caring for the children, the invisible load of peeling all the potatoes that you have to peel, right? You're running your business, being a boss. So all of a sudden we found ourselves in a type A. And then, of course, there's the pressure of wanting to keep up with others because we compare our authentic self with people's fake exterior. So they're never going to match, right? So we have women coming in who are exhausted. One of the biggest complaints I hear, they say, I want to lose weight. And it's funny, I'm like, you're coming to us to lose weight. That's so interesting. But I love the intersection between fitness and mental health.
It's huge.
But they're carrying all this stress. Their cortisol's off, their hormones are off, right? And they're burnt out, they're tired, they're depressed, and they're anxious.
Yeah.
So what are we going to do? We're going to go to the doctor, and typically they've been like, well, here's your SSRIs.
Yeah.
Try that. Zero education, zero follow-up. And to be honest, ethically, SSRIs should only be prescribed with therapy, right? Because
So doctors are able to prescribing SSRIs
Yep.
instead of
instead of recommending, or they will recommend therapy, they just say it off the cuff.
Yeah.
Because first of all, they're ill-informed, right? They don't understand benefit-based businesses. They don't have the capacity to do therapy. Remember a long time ago, doctors used to counsel, and they probably shouldn't have been in their office, but they did.
Yeah.
So we know that medication alone is like 70 something, low 70s effective. Therapy alone is mid 80s, but together they're in the like 91, 92% effectiveness. So we have women coming in who have done a little bit of piece of the puzzle, but they haven't done it all. They're exhausted, and now they hate their partners. They're disconnected from their friends.
Disassociating.
100%. Relationships are strained. The familial relationships are strained. And what if you have those women who are now caring for older parents? And you've got that caregiver role. So the burnout is real.
It's like you're managing up, you're managing down, you're trying to manage it all.
Manage it all, but also look good, feel good, act good. Do you remember the scene
Be
from
healthy.
the Barbie movie?
Yes.
Right.
Bang on. That was so good.
To tears every time.
Yeah.
I watched it on the plane recently. I was just bawling.
I know.
I love that movie.
I know.
Judge me if you will. I don't care.
No
we can't
judgment
be
here.
friends if you don't.
Yeah,
like it.
I agree. And like right now, obviously we notice this shift, right? I'm going off script here, so I apologize.
Okay, you can go.
I feel I like talking like, yeah, I know. Let's just get into it. When we connected, I was like, this is what I'm noticing. And I try to kind of, like I said, fill the gaps of saying, I want to give the best care possible for my clients. And when I do that, I'm like, I got to go to experts and that people that know this area, because I know what I do, but I don't know everything, right? And I need to go to the experts that do know. And I was like, what are you seeing? Like trying to gather as much information as possible, because I want to help. And we are noticing this huge shift of like depression, anxiety, like you said, the mental health side of it, but also the weight gain portion of it.
The physicalness. COVID was, we can still talk about COVID.
We can. I try not
had
to
a
focus.
Pandemic.
Yes.
Okay. The entire world had a pandemic. We are still trying to regroup, and
Yes.
it didn't hit everybody the same. It was not equitable. We know that. There are definitely silver linings for some people. Some people, it was really devastating. But we cannot deny the effects on our body, both from the virus and the vaccine. It's well documented in all PubMed papers. It's either way, whether you got vaccinated or not, you got the virus or not, it's there.
Yeah.
So we're seeing a lot more symptoms, and for some reason in women, and I think it's because if you've ever followed the work of Dr. Gabor Mate, he talks
Yes.
about autoimmune disease hitting women more
Yes.
because of those issues I just listed. So then, of course, the symptoms from the virus are hitting women more. So we're seeing women with dysautonomia. We're seeing them. We were just talking about with your previous guest, ANS system dysfunction, right?
Yeah.
These are all things that therapy can address so that they can get to the physical work of working out,
Yeah.
which releases serotonin,
Yeah.
right? They get some adrenaline in there, cortisol, which is good for you, especially when you can dictate how that cortisol works. And there's nothing better than that feeling. There is no workout you'll regret. I stand by that.
Me too.
Right?
I agree. I totally agree.
You can be yawning the whole time, and at the end, you're like, oh my God, I love my life again.
Yes.
So why not pair that with mental health and with a dietitian and that overall? And what about if we can get you a prescription for some hormones?
Yeah.
You could be like a new person,
Tomorrow,
right? Tomorrow.
It's like that's the fix. And it's hard to kind of navigate our health system. And we've talked about this so many times of saying, like, where do people start? How do they get these resources? They go to their doctor and then they have the conversation with their doctor, but they only get 15 minutes with their doctor.
And if the doctors don't subscribe to the Menopause Society documentation and info, they actually shouldn't be prescribing some forms of HRT. So they'll stay within the patch. They really don't have a lot of information. They don't actually know what they're looking at sometimes. And a lot of physicians have said, I don't even know what a proper hormone panel should look like. Then you have the new leaders who are saying, it's pointless because they shift every day.
Yeah.
So, okay, I'm a fan of that because then we're just believing women. Oh, you tell me you have hot flashes, you're not sleeping through the night, done. I know what to do.
Yeah.
We'll give that a whirl, and then in 3 months, we'll probably tweak it. But how do people know
Yeah.
where to start?
Where's their starting points, And where are the answers? Because it's like they just want solutions and they're trying to find it and they're trying to navigate it themselves. And then they're kind of going down these paths of, well, maybe I'll try Ozempic. Maybe I'll try, easy things, which we've talked about. It does work for short term.
Yeah, there's a place for it in some situations for sure. but it's not everything,
No.
right? And so here's the tricky part. The information that we know is the information that's readily available on the internet.
Yes.
What people don't know is that the internet actually has a ton of blockers and fields that sometimes you have to pay to get through.
Yes.
And so what we see are big pharmas, big companies pay to get through those blockers. So that's why you're seeing their info. The, so-and-so health, get your prescription online. That's why you see them, because they've paid the expensive script fee to get through.
Yeah.
But you have a lot of resources here in Ottawa that don't pay those scripts to go through. We're not playing that game,
No.
right? We're just going to do it the good old-fashioned way. We have a roster of women and good word of mouth. And to me, experiential and being around for 10 years is our good word of mouth, right? And
Totally.
that we can help people that way. We don't need to necessarily go through that route on the internet. So I say that because you have to be mindful of what you're reading online.
Especially now.
And if you're wondering why Ozempic or like peptides are coming at you, it's because they've paid to do that, right?
I'm so glad you're touching on this. It's such a tricky conversation because obviously it's done wonders for people, but at the same time, we're on the other side of it being like, we've been through this, we've done this, we know what the side effects
100%
are going to be coming
If you
up.
go off it, you will revert back, and that is well documented, right? So the entire time you're on it, great.
Yeah.
You can keep weight off. It can seem like a quick fix. But again, once you go off it, and it's also not going to fix your dysfunctional eating patterns. It's not going to fix your lack of exercise. It's going to contribute to muscle loss, right? Bone density issues. So
The
that's
shredding of the bones did you see that picture? I was like,
it's so scary.
it really is. And then you can't fix
Nope,
that.
you
Once the
cannot.
damage is done, it's done.
Yeah, and nobody's going and getting a DEXA.
No.
Right? And comparing. I mean, it's great. A DEXA is great, but it's just a moment in time, and you really shouldn't do repeated DEXAs. It's radiation. Good old-fashioned pavement pounding
Yes.
and
Yes.
weightlifting is going to take you so far in
Thank
life.
you. I'm so happy to hear you say that because that's my message constantly of like you have to, but you also have to fix the root problems
That's right.
and go deep and figure out, there could be trauma
100%.
and we're not dealing with trauma.
People think that, I think maybe it's hard because I'm so immersed in mental health that it seems normalized to me, but I do think it feels scary to some people still. And in particular, women who feel like, well, no, I got a grip on it. I can't let it go.
Yeah.
So yeah, your previous tight pelvic floor. Yeah, heck yeah. Because
Yeah.
they don't want to let go this auspice of control that they have. But truthfully, we try really hard in our clinics to normalize. We're just having a conversation.
I know
We'll
you do
go
such a
slow.
great job.
We'll talk about the things. These are standard among so many people, right? And then it feels accessible. And you're like, oh, okay, I can make this change. Then cue the workouts. Cue following a meal plan. Meal plans are not dysfunctional eating. Getting in proper macros is not dysfunctional.
Nope.
You're allowed to weigh your food if you want.
Yep.
Because you underate and you filled up on jubes like me for a long time before skipping meals, just filling up on candy, right? Trying to get to the next appointment. Therapists are the worst historically, just so you know. We don't always prioritize our health, I've learned. But we just want to normalize this. Good old-fashioned exercise, talking to people, sleeping.
Yes. Sleep.
Oh
is
my gosh.
Huge.
It's so huge. And I mean, I'm somebody who's wearing like 2 devices right now to track their sleep, but I'm so interested in data collection and what affects sleep quality, particularly amongst women who are coming to our healthcare clinic, right? Because sometimes it's biological, and we're seeing that we need to supplement with like progesterone, estrogen, testosterone at times, and sometimes it's more mental health related, and sometimes it's both. Often, actually, it's both, if we're being honest, right? The things that keep us up or delay us from sleeping.
And you talked about hormones. So if let's say I was a client at Freeform and I'm having these struggles, do I go to my doctor? Do I go, or like a naturopathic doctor? Like where do we get this information? So we have a good idea, and then we have the right resources to help us.
To be honest, if everybody was asking, I would say for a very small investment, let us triage you and give you a full 30-minute assessment. It's
That's it?
$130, okay? You get a 30-minute assessment, virtual.
That's it?
Yeah, this is it. Virtual or on the phone. Leah, our nurse, our clinic manager, she's fantastic. She'll go through it all, and she'll give you the honest answer. Here's who I think we should book you in with. And you can choose. Do you want to do the ND? We've got that. Do you want to go with the nurse practitioner? We've got that. Do you want to go just right to the dietitian? Do you need a workout plan? We'll triage you through. Maybe you need all of them. Most people need all of them. Naturopathic doctor and nurse practitioner have different scopes of work. So right now, nurse practitioners are the ones who are the most covered, and pretty soon we'll be billing with OHIP with nurse practitioners. They can order lab work. They can prescribe both compounded or pharmaceutical hormone replacement, whereas naturopathic doctors have a different scope, and not all can prescribe.
That's helpful. I didn't know the difference either, so that's good to know.
Yeah, but if you need to deal with gut health,
Yeah.
naturopathic doctor, that's your go-to, right? So that's why we do the triage. Let us help you navigate. It's such a small investment. And if you take that and you go away and you go, I'm going to go to my family doctor, 100%. We support you. We'll be here when you come back.
And then they can go through their family doctor and just kind of get...
Yeah, they might want to get a prescription there. They might want to start there. They might say, my family doctor has been dismissive, because that often happens too.
We're noticing an uptick in that. But and it's not their fault. Like, I feel like they're just overworked and they have so many patients and it's hard to keep up,
It's a combination for sure. It's overworked, right? We know that the pandemic was really hard on our healthcare, right? We all felt it. So physicians are leaving faster than ever because they're feeling overwhelmed. They can't keep up with the roster. They're ill-informed on midlife care for women because they didn't get the training. It was really not covered in med school very much. And unless they went on their own and got that enhanced, they don't have it. Or they just prescribe what they think they know, right? They're like, well, I'll give you a patch and some Premarin. That's not for everybody. And there isn't any information given along with it. So we live in a world where a lot of people have benefits.
Yes.
A lot of people are focusing their income to allow their health to survive, right? Because if we don't have our health, the rest
What do we have?
Doesn't matter.
No.
Great, you can make your mortgage payment, but you feel like crap.
Yeah.
So the idea is that we're trying to encourage people to allocate a small amount if you don't have benefits to care for yourself, because it will take you so far.
Yeah.
Right? What you can achieve and your level of consciousness and happiness.
It's huge.
Yeah. And so short.
Yeah.
Nothing is promised tomorrow.
And we see it all the time, right? Where people just get these situations that happen and then they're like in here and they're trying to save their life now when you're like, there's preventative,
yeah.
Focus on the preventative side,
And preventative healthcare is not going for a scan, getting a DEXA. I mean, there's places for it, but it's not doing a preventative MRI or a preventative ultrasound. Preventative is working out, start young, build like healthy habits that you can teach your children. It's learn how to deal with your emotions, unpack your crap like the rest of us, right?
Yeah.
And then learn how to zip it back up,
Yeah.
address your thoughts and your sleep and your food.
Your stress.
That's, yes, 100%. That is real, true preventative healthcare. We call that lifestyle medicine, which is something that we do. We have two of us who are Harvard certified in lifestyle medicine. It's intertwined in everything we do in the clinics.
I love it. What are you seeing in terms of, because now I've noticed an uptick, and I'm just being open and honest of, we talked about depression and anxiety, and a lot of people are on medication for it now. What are we seeing in terms of side effects with that?
Well, there's lots of different things. So there is a terminology that's funny. It's called the pooped out effect. So we actually see meds can stop working. Okay. That's one thing. We see.
So you have to increase the dosage?
Depending. Sometimes the dosage increase doesn't do anything. Sometimes you need to change meds, right? We're seeing metabolic syndrome. So we know what that is. It's like the weight gain in the middle. It's very difficult to alleviate. And then we're seeing an increase in diabetes.
Yeah.
Right? Because we're having insulin-resistant issues. We have folks who have tried going on semaglutides, peptides, to try to correct that, but actually it can swing completely the other way, and now they're hypoglycemic and their bone density is suffering.
Can't win.
You can't win. So the idea of having more innovative treatment is really important. So we can do the lifestyle method, which is like, counseling, dietitian, working out.
Yeah.
That's going to win every day. But we can also layer on additional things. So we do ketamine-assisted psychotherapy. It's a very safe, non-invasive way to accelerate therapy and really cut through a lot of that build-up time that can happen. It removes a bit of a barrier. And we all love this word, neuroplasticity, but it actually targets your brain. It makes it more malleable. Therefore, the therapy works faster, in a nutshell.
So you talked to me about this, and I was so shocked because there's such a taboo with, and I'm just being, transparent with the word ketamine, because you think of it as like, oh my gosh, it's a drug, and it's like people die from this,
It's a medication, so it's a surgical medication,
Right.
Right. So we get it intravenously for some surgeries, especially if you're awake, brain surgery.
Yeah.
There's derivatives of ketamine that are used in surgery. It is absolutely abused on the street like every other med
course.
out there. It is
Yeah.
unsafe to take,
Yeah.
unregulated. So you get it from a prescriber. You have to go through an assessment,
Yeah.
a full mental health assessment, an hour long with our prescriber. And then it's a prescription that's written, compounded locally in Ottawa from the wonderful NutriChem pharmacy.
Oh, lovely.
Yeah, they're
they're
great.
amazing.
So we know the efficacy of it is phenomenal. We've had great feedback on it, and it's administered sublingually. So under the tongue, we can top up with a nasal spray. You're in and out in under 2 hours. Like it's you can't drive.
Yeah.
You have to sign off on all the
Yes.
forms, but the results are amazing.
So what are the results? Like, I'm dying to know
Oh
what
my
you've seen.
gosh. So there's a flow in therapy that can take years, and I'm not kidding, because I do psychodynamic and psychoanalytical. I see people for life if they want. Okay, so it's something that's very different, and it's for more seasoned therapists. So we want to build up a rapport. We want to bring people up, and I'm kind of showing this like peak in the mountain.
Yep.
They get their therapeutic breakthrough, and then we want to zip them back up and come back down. This peak could take years at some people.
Yeah.
Sometimes months.
Because it could be, these are breakthroughs, right? Like
100%.
Yeah.
These are breakthroughs. You have to be the right timing.
Yeah.
We do all
right place. Right.
Psychotherapy is a brain altering technique, right? So counseling is not just talk therapy.
Yeah.
We're actually altering your brain neuroplasticity.
Yeah.
Well, ketamine is like nitrous. And so what it does is it in one session, Ashley, it's so cool. I warm up with them. I feel where it's in their body. And once I sense it's up ready in their head, boom, we have that therapeutic breakthrough. Boom, I zip them up, come down, one session, what could have taken me years to do with somebody.
Wow.
Yeah, and we're seeing 4 sessions, and people are essentially whatever they set out to do, what I wanted to work through, what I want to figure out, 4 sessions, and they're really figuring it out. It's like you've uncluttered an attic.
Yeah.
The boxes are all there, and then some people continue on with therapy. Highly recommend that, because you still need to put away the boxes that you pulled out.
Yeah.
But for some people, they're able to go off medication if they were recently put on medication. For folks who have been on long-term meds,
Yeah.
we're saying don't anticipate being able to go off them. And that's the beautiful part, is that you don't have to do ketamine, right? But it is a regulated drug.
That's so interesting. So who's the ideal candidate for this?
So to be able to qualify for ketamine, you would have needed to have tried other things to address your mental health. So it is not a first stop.
Okay.
I've taken, Wellbutrin, I've taken SSRIs in the past, didn't work. Even if that was for a short period of time, I've done therapy, didn't work. Technically, you're a candidate, and you go through the assessment. So, everybody shares different experiences, but we've heard people say, I was going to end my life. I had an appointment with MAID. Yeah.
Are you serious?
And then something called to them to keep going.
Oh my God, I'm going to cry. That's beautiful.
It's very moving. This wasn't my patient, but when our clinician told me about it, I was like, and you didn't tell me about this immediately?
See.
And she booked with us, had a handful of sessions, and has essentially moved on with her life and living her best life right now.
Wow. Life changing.
It is life changing. And for others, it's helped them unpack deep trauma that was there. It's just absolutely amazing. And it's really not a ridiculous investment.
Yeah.
Like if we think about what
worth it.
people are spending on like designer clothing.
Yes.
Or that, trip somewhere.
Yep.
Air flight is so expensive right now. Just
Or
take
like
that.
eating outside too.
Yeah.
Or not
Out of the
outside, but,
home.
like, yes. Yeah.
100%.
It's worth it, you know? Oh my gosh, that's so moving to hear that. Suicide is a big thing, but the biggest thing that we're noticing is the trauma and how it shows up. If you don't address it, it will bleed out,
into your body.
into your body.
Your behaviors.
Yeah.
Your relationship.
And it can stem from childhood trauma, and
course.
we bury it, right? So what would you recommend to somebody that is having, these like flashbacks, or that they can't remember their childhood, or like,
Yeah.
little things that pop up that we're like, oh, this might be something that you should talk to a professional about?
If you're not remembering your childhood or you're having flashbacks, that does lend towards PTSD. There's big traumas, there's little traumas, there's complex PTSD, and then there's sort of regular PTSD. Those are symptoms of a traumatic event or events, right? If you grew up in an environment that was high stress, and it is really important to say, it's important for you to talk to somebody. You don't have to start big. We're not going to come in and say, okay, let's talk about this.
Yes.
We're going to build that rapport.
Yeah.
We're
How do
gonna-
you do it? Like, do you start off with like, what are like general questions you
Oh,
start
these
off
are my tricks of the trade. So
Yeah, sorry. I'm just so curious how do you like make people feel comfortable and to
yeah.
trust to like just I'm sure some people it's just like they've been dying to talk to somebody about something like a professional.
Some are apprehensive, but what I would say to you is like when you and I first met, how did you feel? Did you feel at ease?
Yeah, I did. Well, one, I heard you talk about women's health and the mental health side of it
Oh, right, at the Women's
at
Summit.
the Women's Summit. Shout out Jen Stewart.
Catherine Clark.
Yeah, and Catherine. And I was mesmerized by your conversation, and you did bring up, key things of like Dr. Gabor Mate, and like we connected really highly on that because I do believe, I think he's
And the
a
lift
genius.
heavy.
The lift, how you brought up, like you were the only one to kind of address how important it is to lift heavy, develop your muscle, strength training, and you were really hyper focused on that. But you also brought in like the caveman diet, which I loved that you brought that up because I was like, yes, go back to the basics.
Yeah. Keep it simple.
It's simple.
So that's how I form a rapport with everybody. How's your day going? Tell me a bit about yourself. We want to conduct this full biopsychosocial kind of picture of like, who's Ashley? Like, what was she like growing up? And what's your day-to-day like? Are you living with somebody? What do you do for paid work? Tell me about your dog.
Yeah.
Right? I know
That's
everybody's
an easy one. I'll talk about my dog for hours.
Right? So we bond. And we
Yes.
talk, and then I tell people about my pug. She's not a dog. But
Yes.
Her name's Sandra. So, you form a humanistic relationship first. Because if somebody doesn't feel safe in their space, they're never going to be able to open up. And then we kind of go from there. And then we kind of analyze things that are coming up. We feed that back to you. I ask permission to go. May I ask you about this now? How did you feel when I brought that up? Where were you feeling that in your body? And then you slowly start to see that this in vivo experience of the therapeutic relationship is in fact the therapy.
Yeah.
Right? And then we just keep layering on and figuring out where they want to go next. People are in charge of their own session. I always say that.
I love that. Because it is, you're nervous. You're like, am I going to,
100%.
and I like, what are they going to say that I'm crazy or like, or that are going to diagnose me? But
Are they judging me?
yeah,
I get that a lot.
but it's private, right? So the other thing too is I believe everybody should do therapy, truthfully.
Me too.
So I think it's crucial for your physical health because if we don't address what's really going on, it's going to show up in different ways.
100%. And not everybody's going to develop trauma,
No,
right? But
because people think, I have to have had some type
Yeah.
of trauma to go
No.
talk about it.
We can do therapy to make you a better leader, to be more confident in yourself, right? To select and move towards a goal. So, let's say High Rocks is the big thing people are
Yes.
competing for right now. There's always a fad. We can help you with that.
Yeah, I love it.
So you can do the training. We can do kind of that planning, visualizing. These are all therapeutic techniques. You have some adjustment in your work. You're not happy. You don't want to. We're hearing a lot of like, I don't want to go back to the office. That is heavy for so many people
That
in
is
Ottawa.
huge right now because it is. It's like, why can't I do this work from home? And I get it. Like so-
Totally. And it's going to affect communities. Rural communities are going to be affected. People are displaced again. And so there's heavy things that happen that people don't think are therapy reasons, but they are therapy reasons. There's
and not to mention what's going on with the world. Like that is heavy.
Oh my gosh.
You're like, every day I wake up, is something going to happen? It's exhausting.
Yeah, and my free advice right now, turn off the news.
Yes.
Turn off the news. Don't let social media algorithms dictate your day.
Yeah.
You can curate and keep up to date, but I promise you, it's all still going to be silly until, something big happens, and try to follow Canadian information.
Yes. Burnout. Let's talk a little bit about burnout because we often see, clients that are burnt out and they're just like, I need some type of release.
Yep.
What do you see when it comes to burnout? And
Yeah.
is it, like what are the symptoms? People just think, oh, I'm tired, but
Right.
it's so much more than that.
And I think I remember saying this at the Women's Summit, that burnout starts like a little whisper, like I can't sleep. I'm hungry all the time. So it starts with these subtle little things, these nuances that your body's feeding back to you. Or like, oh, I forgot what I was doing. I just left the room. I got to go back. It's subtle. Where it really starts to show up is in your performance. And this is what's really hard, because then people do assimilate it to, oh, well, my performance was suffering, therefore I'm not good enough. Unfortunately, that's the combination that you've made together, but actually your body was telling you a long time ago. So missing work, irritability, right? Irritability with people in your life, people you're close with, losing your patience. You're going to see physiological changes. So fatigue from lack of sleep, disrupted sleep, sex drive is going to be low. Your appetite's likely going to have changed in that you're going to either skip meals and crave sugar, carbs more, or you're going to lend to drinking like Monsters or caffeine more. So we're going to see big changes there. Your gut health's going to suffer. Right? You're going to all of a sudden have IBS back. You're going to have tight pelvic floor come back and have incontinence. So burnout shows up in kind of those physiological ways, and then absenteeism. I don't have an interest in the things that I liked anymore. I'm nervous about going to the store now. I seem to not want to go. I'm no longer interested even in like walking the dog. Right? I'm missing my workout sessions. I'm sure you see that and you kind of worry about people, right?
Oh my
Who
gosh,
don't come
I
back.
worry so much sometimes. That's why I'm like, I want to give them the tools, to help them as much as possible. But it's hard. I can't show up in their life like I want to. If it were really up to me, I'd be like right there with them,
Right. And I think that's really important for clients to know, that whomever is working with them, whether it's you or it's us, is that we actually want to be there. And for them to almost picture like that we're there wrapping around us and support.
Yeah, that's how I envision it. Like just like hugging, like I just sometimes want to hug and be like, you're safe.
It's okay.
You're okay.
Yeah, you've got this.
Yeah, you can do anything.
So we're just giving them the tools, right? There's nothing that I'm actually doing and giving them. I'm allowing them to come to that. Just like, you can give them the tools. Here's what you need to do. Here's the space, but they're the ones showing up.
Yeah.
Right? That lunge is them. That weight, that plate, that's all them.
Yeah. And it's showing up.
Showing up and cheering you on.
Yeah. I love it.
That goes a long way, especially when dealing with burnout. So I would say if somebody's at the stage where they're now seeing the bigger symptoms of like work performance, fatigue, sleep, things like that, depression, anxiety, that first step is counseling, and then let us help you make the plan to get you back to where you want to be.
I love it. Okay. What are small, realistic habits that actually move the needle?
This is all going to be lifestyle medicine. So sleep. First and foremost, like we've said, sleep 100 times if we want.
And when you say sleep, like they should be getting 8 hours of good, deep sleep, REM sleep?
I like to say between 7 and 8. And I was somebody who used to pride herself on like, I'm good at 6. No, I wasn't good at 6. I thought I was good.
That's why you have two
right, yeah. Two
watches, yeah.
So regular bedtime and a regular wake time. Those are key indicators. So the idea is that we want to observe the sun rising as quickly as we can. So our brain responds. We still have the same brain as caveman. Right?
Yeah.
So our brain would witness the sun coming up. We'd be like, okay, time to go and get food and do all the things that cave people do. And then it would set and it'd be like, okay, time for sleep.
Yeah.
We're more complicated in between now, but that's still our brains. So get that circadian rhythm in line. View the sun coming up and view it setting.
Yeah.
Okay? And keep your bedtime, wake up around the same every single day, including weekends. I know that sucks sometimes, but it's really important to regulate your nervous system.
Yeah.
So sleep, number 1. Try not to, I know people are going to hate this. Don't have your pets in your bed if you can help it, particularly in like this midlife, because sleep is so precious. White noise works really
that,
well.
Mom?
Yeah. And I tell everybody, they're like, no.
I'm like, no, my dog cannot sleep in my bed. I'm one of those, but yeah.
You need to sleep. Right?
Yes.
To do all the amazing things you do, you need sleep. So try to keep bed for like intimacy and sleep. That's it. Okay, no pets and I know kids, and anyway, that's a whole other thing. We can talk about kids on the side. Also food. You need to eat meals.
Yep. No skipping.
No. when I hear people say, I just graze all day, on the inside, I'm like,
I know.
we need meals.
We do.
We really do. You can have snacks in between, but you still need meals. And you need all of the micro and macronutrients, okay? So carbohydrates are not the enemy. They actually fuel your brain. So you need to have a balanced diet to whatever that looks like for you. Everybody's different. You need to drink water.
I love that you said everybody's different. Like it's a custom approach. You are different. So a one size fits all is not you. Like you are individual for a reason.
Right.
And you have so much like we even say that for working out. You can't just do a regular workout that everybody else is doing because your body is so different.
But that's your whole business,
It
right?
is.
It's custom, it's boutique, and that's our business.
I love, and that's why it's such a good synergy because it is a custom approach to the individual and not just a cookie cutter.
We're not the public
blanket.
healthcare system, and you're not a big old box gym.
Exactly.
Right? So that's very different. So identifying what your needs are makes sense, and then start to follow it. Drink, hydrate your poor brain. It needs it. So many people are coming in, and we have lots of issues going on. Like we deal from everything in office, from constipation to like bladder shyness, and it's all related to eating and drinking. Right? So, if you take care of your primary needs first, the rest is easier to layer on. So those are some really practical things to do. The extra bonus is move.
Yes. Every day.
Every day, walk, plan something that you're going to do. You can work out at home with nothing. You can just do body weight movement, whether that's yoga, plyometric stuff, jump squats. Lately, I've been into kettlebells. It's so weird.
We go through phases.
Right? I'm like, this is really fun. I feel like it gets my heart rate up. So making little goals for yourself, I'm like, I wonder if I can go between zone 2 and zone 3. It's just a fun game.
Yeah.
But you have to play those games to keep reinventing your fitness, right? When you've been at it for so long, things can become mundane.
Yep.
So people say, well, I don't have the motivation. Motivation is like a fleeting thought. It comes and it goes.
Yep.
It's consistency and routine.
It is. And for me, I'm like, I've been doing this for 20 years and I still need my trainer because it's an
100%.
appointment. And in my mind, it's like, okay, I don't have to think about it. I show up and then I'm consistent with it.
Yep.
And all I have to do is show up for that appointment. And in a weird psychological way, I can do that. But if you told me I have to go to the gym, by myself and push myself and think of all the workouts and I'd be like, no, I can't do that.
I've always had a coach.
Yeah.
Always. And then when something comes up and the workout isn't feeling good or something changes, she helps me. She helps me adapt my form, right?
The form is huge.
It's huge.
It's little minute things that make such a big difference.
Yeah, it's key. So, and I recognize not everybody thinks that they have access to that, but I would actually say, have you looked into it actually? Have you called Ashley yet?
Yeah.
Because there's different things out there for everybody.
I love it. Why do people struggle to stick to habits even when they know they're good for them?
Neuroplasticity. So, the idea that, have you heard of like,
What does
Cleary.
the people that don't know what neuroplasticity is? What is that?
So your brain is like a roadmap or like a trail in the mud. That's a good one. Muddy trails. And you've got these muddy trails that are really engrooved. And those are your thoughts, your habits, your routines, okay? And your feelings that we've assigned to things. They are ingrained. They're really grooved in. Well, in order to form new ones, we have to do something different, think about it, and then counteract it to form a new muddy trail. That takes a lot of work. So, and they're not as established as those big, deep tracks. So when something falls off and you're like, crap, I was running late, I didn't make it to the workout, well, you're going to fall back on that old muddy track. So this is why things like ketamine and therapy are so effective to try to ingrain habits and help them stick. So there's lots of books out there, like there's James Cleary does the habit thing, and he talks about, it takes 21 days. It's actually, that's been a bit debunked, I'm sorry.
Okay.
But it's more...
I'm glad you're bringing it up.
It's actually more repetition. Your brain learns through repetition. So our brains are really simple. We have a thought, we believe that thought, and then we assign a feeling to it. But technically, that thought is just a thought you had. It's not a fact. So what we do is we teach you how to analyze your own thoughts, assign a thought that actually makes more sense for your goals. Then we assign a feeling to it and a behavior. So that is cognitive behavioral therapy, which helps form new neural pathways. this is why people fall off with habits, is because they think it's just gonna happen, and it's not. It takes repetition, it takes support, right? Coaches,
Yeah.
and it takes consistency. It's
Wow.
not gonna happen overnight. Like, just, like I've cut out your rice cakes for 5 days. I should be down 5 pounds. Nope. Nope. Right? That's not how it works.
I wish it was that simple,
Right? And there's no number that's a dream number. It's about how you feel, right? And it's more of a picture of health.
Yes.
I think that
Because you have, it's true, there's this aesthetic side of like wanting this aesthetic, but the truth is there's so many different shapes and sizes. And
the aesthetics draws people in.
Yeah.
But I think the education is what keeps you there. And we're training for longevity.
Yes.
Right? This is what we're doing. We
Yep.
are all about making the person healthier, stronger, fitter, so that when you're 80, you can do whatever you want.
Yeah. And you're aging healthy. Like, age healthy.
Yes.
I think that's
Hurrah.
the real goal here, I love that. Do you see differences in clients who have some form of regular movement compared to people that do nothing
Night and day.
night and day?
You can't even compare the two. So the folks that don't do anything have a higher rate of anxiety, depression, adjustment disorder, mood dysregulation, and relationship dysfunction. Isn't that crazy?
That is
That's
really crazy.
just because they have no movement in their day. They're in their head all the time. So the folks that have either like a regular fitness routine that they do, or they have a friend that they walk with, or they do yoga, those folks make more progress faster, and they have a reduced rate immediately of anxiety and so generalized anxiety. We do a GAD, or depression, the HAM-D, which is a depression assessment. Their scores are always lower.
That's fascinating.
It really is. And we know that there's lots of, I'm
Yeah.
not a scientist, but, we know that muscle releases proteins in your brain that can contribute to serotonin uptick, because we need serotonin. The thing is, you can't find it. You have to make it.
Yeah.
What you can find is dopamine. But dopamine can be like anything. Like, I want to look at that. I want to think about that. I want to touch my phone. I want to eat candy. I want a coffee. That's all giving you dopamine. But it's only created on the outside. So it sucks when you can't find it, or those things no longer do it for you. So dopamine is sort of secondary. Serotonin is what you make through exercise, through sleep, through new neuroplasticity and brain connections. And that's really important for people to know.
Yeah.
There's lots of great podcasts out there that talk about the connection between exercise and mental health,
Tons.
who really get into the nitty gritty of the science of it. If you're somebody that likes to geek out on
Yeah.
science stuff.
And go deep and go really
That's
deep.
not
with
my
it.
jam. I'm a normalized approach,
Yeah.
but there's lots of folks
We
out
like to
there.
normalize it just to make it simple for our clients, and just so that they have the resources to kind of just figure it out.
We're all in this together. We're
we
all
are.
humans. None
Yeah.
of us are sitting behind, scientific papers and PubMed papers. Guaranteed, even if I recommended one to somebody, they're not reading it.
No.
Right? 'Cause it doesn't interest them. They're just like, just tell me.
Yeah. They're just giving me the cliff notes, bullet points.
right.
That's helpful. For someone who feels overwhelmed, what's the most approachable way to kind of start? What's the best way to start?
So I will have to say, if it's a woman coming to us, first start, just book the call with Leah.
Yeah.
Book the call with Leah. She will walk you through everything. Just come in green and we'll talk you through it.
Yeah.
If it's somebody, because we also treat men, children, youth, families. If you're feeling overwhelmed, call, say, I'm feeling overwhelmed. Where do I start? We got you.
Yeah.
Right? We'll talk you through it. We'll ask you a couple of questions and we'll line it up with your schedule. We'll make it so easy.
I love that.
We're here to help, right? Every step of the way. You don't have to pre-think all of it. We can just take it step by step.
And you can meet them virtually as well. Like it doesn't.
Sure,
Yeah.
of course. Yeah, we do have the 3 brick and mortar. I am a big fan of the in-person.
Totally.
But there are some of our services are combined, like our nurse practitioners are virtual, but then you can come in for a nursing once over if you need it or require it. You can do a combination of both. And I think that's what's really important, is that know that there's a space for you if you need it.
Yeah.
But if virtual works best, we can do that. And ethically, if we felt like being virtual was keeping you stuck, we'd tell you.
I love that.
We say the
You're
hard
so
stuff.
honest, which I that's what I love about you, is like you're real. You're not afraid to sugarcoat, like you don't sugarcoat things. and that's why I was like, I need to get you on the podcast because you're just so honest and real about it. And I'm like, this is what's going on. And I come to you for anything. I'm like, oh, what do you think about this? You know, because I just want to tap your brain a little bit on what you think is this.
We've got to be honest, and that humanistic approach will take you further. I've also lived through it, right? And I've been in the game a long time. And I think that also really helps. There's an understanding. I've seen a lot of different things. And I'm so grateful for the work that I get to do. I've experienced so much, I mean, sad, but also happy. And I get to witness it. And I think it's just such a gift.
You are gifted. When is it time to seek professional help?
So I often say it's not a moment in time. It's not like, I had a crappy day. Was it a crappy day or was it a crappy couple of minutes, right? I spilt my food twice yesterday in my car. I know. I'm sorry. I know I eat in my car.
Twice?
Yes. Spilt my coffee because I take a coffee mug. And then I spilt my ground turkey and my green beans. And you know what? I was like,
I was so looking forward to that.
But it was just a crappy couple of moments. But when you're like, oh my gosh, for 2 weeks, I have not been sleeping well. I'm finding myself like discontent with things in my life. I'm questioning things. I'm fighting with people. I don't feel my best. Something's off. That's the time. If it's been more than a couple of weeks, I say more than 7 days. But you know what? Nobody's coming that early. I'm hearing people like, oh, I've been meaning to come for a few years. That's what I'm hearing. And then we're like, okay, buckle up. Let's have a seat and we'll get into this. Ideally, if you feel off and it's been a couple of weeks, preventative is always best. It doesn't mean you're going to have to come every week.
Yeah.
Maybe it's like, okay, this is what we're going to work on. Come back in a couple of weeks. We'll try this out. We'll create a tailored plan, whatever's going to work for you and what you have to work with.
I love it. For somebody, like, I feel like our clientele are, our target, like our demographics a little bit older. And I feel like they have the old school mindset of like, I don't need therapy. This is part of life, which is sure, but how does that show up?
I know.
It
shows up in rigid protocols, that rigid thinking. So we do see a lot of that kind of in the generation. I'm going to say, my generation and above.
Yeah.
So mine and the boomer generation very much had that very conservative lens sometimes of you work the job, you get the, retirement, you get the pension. You just suck it up and you don't complain. You get what you get and you don't complain.
Yeah. Be grateful.
Yeah. And now I'm saying both can exist. Two things can be true. You can get what you get, but you can also talk about how that doesn't feel fair. We want to model accessibility for future generations. It's just like you don't plant the tree now to get the benefits. You plant the tree for your grandchildren to get the benefits, right? So if you're a happier, more content person, all of those around you are going to benefit. Some of the most memorable work I've ever done in my days of like really working with patients was actually the work I did with an older population. And I had people in their 80s coming in, and I'll never forget this one woman who said to me, and she was very teary and she had made a lot of success with her anxiety. And I've been thinking about her a lot lately. And it's funny, we think about people, and it has been 10 years since I saw her, just to give you an idea. But she said, I can't believe I lived my whole life feeling this, and now I know what it's like to feel different. And like even when I think of
free, probably like this freeing feeling of like,
she didn't know what anxiety was. She thought that you were always supposed to worry about your kids getting into accidents when they, like, as grown adults. She thought you were always supposed to dread the future. Like just this way of thinking that her brain got so accustomed to, and it truly just taught CBT, cognitive behavioral therapy. She learned another way to think about it, and everything in her life changed. I don't know how long she lived for, what happened, but I'd like to think that she lived out the rest of her days happier and more content. And like that could be my ticket to heaven if there's such a heaven.
I believe it.
It was so special, and she did such wonderful things in her life. Everybody deserves that. So there's no limit to when you can start therapy. And I can almost give you the Christine promise that they're going to feel better.
I know. And no, you don't have to almost promise. I know for a fact that they're going to feel better.
Yeah.
And it starts with like, I always think of it like inside feels good, the outside's going to start to feel good. And that, like
100%.
It flourishes in so many different ways. And I'm just so happy you're just so open to talking about it. Okay. What would you say to someone who feels hesitant or intimidated to start?
So I think that there's a multi-pronged approach that we could take for hesitation. seize the moment. There have been so many times in my life where decisions have been a bit hard for me. Not a lot, because I have this something I call like unfounded confidence. I feel confident in stuff I probably shouldn't.
You should.
It's a blessing. It's a blessing and a curse.
You can always tell you're like that you've done the work, you know?
But there's been a couple of times that really stood out for me. And I remember reaching out. Therapists, we get tired of talking, so we don't always like to talk about our feelings, believe it or not. But the times where I felt stressed, I did. Talked about it. And I remember the stories that people shared, and it was always a leap of faith. It was always something that made me think, oh, okay, me doubting myself doesn't mean that that's right. It's just a feeling. It's not a fact. And so if there's a moment where you can take a leap, just do it.
Yeah.
Make the call. And we see that a lot. We see people like, I just called because I saw your sign. Or I've been putting this off and I just wanted to make this call. I'm going to book in for a week or two. And sometimes they sit with it, but just make the call.
There were, speaking of your signs, oh my gosh, you have the funniest. I was like, girl, you crushed the signs.
Love the
because
signs.
it made me want to like call, and because it got my attention. I've never seen therapists really put it all out there on your drive-by sign on Hazeldean.
They're
gold.
funny.
It was so funny. I love it.
Good. I love that. And I have to say, I'm really proud of the way that we've changed the game in the therapy world.
Yes.
And it's okay that others are mimicking, copying. It's okay.
It's an honor, really, because
it is. And so I was courageous enough to make the change and shift the thinking. I love that other people are picking up on it, because then in the end, everybody wins.
Yeah.
Right? Everybody's getting seen. We're normalizing it. I even saw somebody put a bus ad on the back, because we've had bus shelter ads for a while. I don't know if they work or not.
Yeah.
Trial
and error.
Trial and error. But the idea is trying to normalize it. And I've just seen people doing different things. And I thought, yes, let's just talk about this. That was the whole idea behind us having street front. We don't want to be hidden.
Yeah.
We are like front and center, in your face. Normalize this. It's important. Right? Otherwise, we just crumble altogether as a society. We can't have that.
No. Okay, so we'll finish on this note. What's one mindset shift that could make the biggest difference for most women?
You're worth it. And I know that sounds kind of cliche, but know that just because you haven't felt as though you should speak up doesn't mean you shouldn't. And that need to speak up has probably been stifled by our medical lens, which is designed for men. We don't allow space for women to speak up. And we also target women with specific things to divert their attention. Right? And so,
What?
Oh my gosh, I could tell you, I have a big fight with alcohol being targeted with sporting events. I dislike it immensely.
I know we've normalized alcohol a lot.
We've normalized it so much, but targeting women, I remember when I used to run marathons, and I'd be like, what do you mean at the end there's beer? What the?
At the end of a marathon?
Yeah. When did we stop giving out bananas and bagels?
Yeah, like something that's going to be nutritious.
And I see it all the time. I've seen it in a recent thing that I did with a women's event. I see it at hockey games. I see it in sports. They're getting ads. So we've purposefully targeted women. And you've probably heard, you could Google this stuff like pink tax as ways to distract us. And I always think, man, imagine if we didn't worry about what we looked like or, what we weighed, what we could do. Right? Or my other favorite saying is, imagine if you had a wife at home, you could accomplish.
I know. I have girlfriends. I was like, she has 6 amazing kids. And I was like, what's the secret? Like, what did you do with, because you had 6 kids, she's amazing career, her husband, amazing career, amazing people. And she was like, oh, I had a wife, like a nanny, but a wife. Another me.
That's right.
To accomplish everything.
And it makes sense given their dynamic. They probably pre-thought that out, and everybody has different situations.
Yes.
But the idea is to set yourself up to succeed. We don't need to be martyrs, and we're not victims.
No.
Right? And it's time that we spoke up for what we need. Hence why we created this gap in our healthcare. Right? You're allowed to ask for it. You're allowed to ask how much things cost, and you're allowed to want it for yourself.
Yeah. And I feel like we're just we're getting there, but it's still a work in progress. And demanding what you want out of life too.
Absolutely. And you can have it all. You just can't have it all at once. Like, you can do anything, just not everything. Right?
I love that.
And so know that you can stagger your wants and your needs and be strategic. Therapy helps with that.
Yes.
And also setting goals. And I'm a big fan of setting goals with fitness
Yes.
because I do believe it's the catalyst that helps us in our professional life. I truly believe that. And I've spoken about it many times.
I've said it too. I've never met a successful person that doesn't work out, to be honest.
And you cannot buy fitness.
No.
Right? You have to work for it. And that working for it teaches you strategy. It teaches you consistency and dedication. That applies to your whole life.
Self-love.
Yes.
Like there's so much that comes out of it.
So much. So set a fitness goal, then come and see us, and we'll just toggle back and forth and back and forth. And before you know it, you're the best version of you wanted to be.
Yeah. We make a great team.
We do.
Thanks so much, Christine. If they want to find you, where can they find you? Just Google Focus Forward Health, or is that the best
Focus Forward
way?
Health will find us. Our website is about to be launched, a bigger and better version. I'm so excited about it.
I can't wait.
You can find us on Instagram. We're Focus Forward Health Group.
Yep.
We now have a Facebook page.
Oh, congratulations.
Yeah, thank you. I don't tend to it very well. Our media team started it. And you know what? You can find us on LinkedIn. You can Google us. We have sheets, and you can always tune in to CTV Your Morning. I'm on about once a month talking about normalized mental health approach, and I think it's so helpful.
Thank you for changing the game, honestly. It takes somebody very courageous and somebody who's wanting to make a difference. So thank you.
That means a lot. Thanks, Ashley.
You're welcome. See you soon.